Good afternoon. What brings you in today?
Hi, I've been thinking about getting Botox and maybe fillers, but I'm not sure what I really need.
That's very common. Let's talk about your goals first. What concerns you the most?
I don't like these lines on my forehead and around my eyes, and I feel like my cheeks look a bit flat.
I see. For the forehead lines and crow's feet, we typically use botulinum toxin injections, commonly known as Botox. For volume loss in the cheeks, dermal fillers can help restore fullness.
What's the difference between Botox and fillers?
Botox works by relaxing the muscles that cause wrinkles, especially expression lines. Fillers, on the other hand, add volume under the skin to smooth lines or enhance areas like cheeks or lips.
Are the results permanent?
No, both are temporary. Botox usually lasts about 3 to 4 months. Fillers can last anywhere from 6 months to over a year, depending on the type used.
Is it painful?
Most patients feel only mild discomfort. We use very fine needles, and for fillers, we often apply a numbing cream or use products that contain anesthetic.
What about side effects?
Common side effects include redness, swelling, or bruising at the injection site. With Botox, there's a small risk of temporary drooping of the eyelid. With fillers, there are rare but more serious risks, such as infection or vascular complications.
Vascular complications? That sounds scary.
It's uncommon, but it can happen if filler is accidentally injected into a blood vessel. That's why it's important to have the procedure done by a trained provider. We take precautions to minimize this risk.
Okay. How long is the recovery?
There's minimal downtime. You might have some swelling or bruising for a few days, but most people return to normal activities the same day.
Can I go back to work right after?
Yes, although you may want to avoid strenuous exercise for 24 hours and not rub the treated areas.
Consent discussion.
Before we proceed, I'll go over the consent form with you. This document explains the procedure, benefits, risks, and alternatives.
Do I have to sign it today?
Only if you decide to move forward today. You can also take time to review it and come back.
What alternatives are there?
Alternatives include topical treatments, laser therapy, or choosing no treatment at all.
Will I look unnatural?
Our goal is a natural look. We start conservatively and adjust as needed. You'll still look like yourself, just more refreshed.
What happens if I don't like the results?
Botox will wear off over time. Some fillers can be dissolved if needed, depending on the type used.
Is there anything I should avoid before or after?
Before treatment, avoid blood thinners like aspirin or certain supplements if possible, as they can increase bruising. After treatment, avoid heavy exercise, alcohol, and lying flat for several hours.
Can I read the consent form now?
Provider. Of course, take your time. I'll step out and come back to answer any additional questions.